good morning. I'm performing hand hygiene and closing the curtain. Hi, my name's Nicole. I'm a student nurse. Can you tell me your name?
My name is Jacqueline Terry.
And what's your date of birth?
10/9/82.
Okay, I'm gonna check your wristband. Okay, can you tell me why you're here today?
For an assessment.
Okay, so we're gonna do a complete head to toe assessment today. So I'm gonna ask you a couple questions. Can you tell me where you are?
At Bevel Hospital.
Okay, and can you tell me the name of the president?
Donald Trump.
Okay, and on a pain scale of 0 to 10, if you could rate your pain, what that might be?
A 2.
A 2? Okay, so you're alert and oriented. I see that you're dressed appropriately for the weather. Can you tell me a little bit about your hygiene?
Yes, I take care of myself very well. I smell like roses.
That's a good thing.
Okay, Miss Jackie, so we're going to go ahead and proceed with the assessment. I'm going to check your vitals. Blood pressure was 128/74. Your temperature is 97.9. Your O2 is 98. And your respiratory rate was an 18. Okay, so you seem to be in fairly decent spirits, good spirits today. Do you experience depression or anything like that?
No, I'm not depressed.
Okay, that's good. That's a good. Okay, so can you remove your sweater for me, please?
Sure. It's kind of
Okay.
chilly in here.
I'm sorry, I'll have you to put it back on in just a second.
Okay.
So your skin feels warm, warm and dry. Your color seems to be good for your ethnicity background. So your skin is smooth. You don't have any bumps. You're not paler in color. Okay, so I'm going to check your skin turgor, and what I'm checking for is hydration. So that's about a +2. You can go ahead and put your sweater back on, sweetie, since you're freezing.
Okay, thank you.
And I'm going to go ahead and look over your scalp
Okay.
and inspect your scalp. Your hair seems to be coarse and full. No bumps. Your face is symmetrical. So let me see your hands. So your nail angle is a 180. Your nails are clean. The shape is good. Okay, so I'm gonna evaluate your neck. If you could lean back for me. Okay, so there appears to be no masses. Your trachea is midline. Your neck is symmetric. There's no goiter, which means there's no enlargement of the thyroid. Now I'm going to palpate around your nose where your sinuses are. Do you feel any pressure?
No.
Okay. Any pressure there?
No.
Okay. Okay, I'm going to assess your temporal mandibular joint, also referred to as TMJ. If you could bite down for me, okay? And I need you to move your mouth up and down for me. Okay. All right. Okay, so now I'm gonna check your corneal light reflex, and then in just a second, I'm gonna check your eyes using the Snellen chart. What the corneal light reflex is just checking the movement, the reaction of your eyes to the light. So if you could just look straight forward for me and try not to look at the light. Okay, they are brisk. Okay, so now I'm going to inspect your eyes. I'm going to look at the sclera, which is the whites of your eyes. Can you look up for me? And look down. Okay. And now I'm going to check your polera, and that is the inspection of the pupils, the reaction of the pupils. So if you could try not to look at the light. Okay. All right, now I'm going to look at your conjunctiva. And they're pink and moist. Okay. Okay, so now I'm gonna take a look in your ears. I'm gonna pull up and back. Now I don't see any drainage. Normal tympanic should be gray in color. Okay. And your ears are symmetrical on each side of the head. Okay, so now I'm going to do a whisper test.
Okay.
Okay, I need you to cover the right side of your ear for me.
Bananas.
Okay, and cover the left side of the ear for me.
Apples.
Okay, apples, very good. Okay, so now I'm going to look at your, inspect your nose. And your nose is symmetrical on your face. If you could look up for me. Look at the mucosa. And I don't see any drainage. Is this tender when I touch? Is it
No.
tender anywhere that I'm touching?
No.
Okay, all right. Okay, and I don't see any discharge. There's no deviated septum, so you're good. Okay, so now I'm gonna take a look at your mouth. If you could do this for me. Mucosa, okay, open your mouth for me. How many teeth do you have?
32.
Okay. Say
Ah.
The uvula, I see the uvula. You have your tonsils still intact. Okay. Moist, pink and moist. Okay, now I'm gonna do check your pulses. I see you don't have any labored breathing. If you don't mind, can you remove your sweater for me?
Sure.
Okay. So I'm going to check your temporal pulse. They're symmetrical. Your carotid. Okay. And your radial. Okay. And your temperature, your skin temperature seems to be warm. Let me check your capillary refill. They're at about a 2+. The angle of your nails are about 180 degrees.
Okay.
Okay, so now I'm going to check for your lower extremities, and I'm going to check your dorsal pedal, the pulse here in your feet. Your skin is warm and dry. Your capillary refill is about a 2+.
Okay, that's good to know.
So yeah,
Not swollen.
you're not swollen. You don't have any edema.
Great. Thank you.
Okay, Miss Jackie, I'm gonna assess your heart, listen to your heart sounds, okay? This is your aortic. Pulmonic. Your Erb's point. Tricuspid here. And your metrial. I don't hear any murmurs. Normal S1, S2 sounds.
Thank you.
Okay, Miss Jackie, earlier I didn't check your second cranial nerve optic for visual acuity, so I'm gonna get you're standing about 20 feet back. This is a Snellen chart, and I'm gonna get you to cover your left eye for me. And can you read the third line?
Yes, T-O-Z.
Okay, very good. Can you read the fourth line?
It is P-E-C-T-P.
Okay. And what's the smallest line that you can read?
EDFCZP.
Very good. And cover the other eye for me. And can you read the second line?
FP.
Okay. What about the fifth line?
PCCTD.
And what's the smallest line that you can read?
EFFGP.
Okay. Okay, Miss Jackie, so based off the visual acuity test that we just performed, I feel that you should go ahead and follow up with your eye doctor, just get you a checkup, follow up with them. So we're going to go ahead and move along to the musculoskeletal assessment. If you could extend your arms like this is pronation, and turn your arms over, this is supination. Okay, and then I'm going to get you to stand up and bend over. I'm going to look for the curve in your spine. Okay, all right. So can you rotate your head like this? Okay, and can you turn side to side? Okay. Can you roll your arms, circle? Okay, all right. What about your fingers? Can you move your fingers? Move your wrist?
Yeah.
Okay, so pull on me. This is the trapezoid. I'm gonna look at this. Okay, all right, and flex your arms for your biceps. All right, and move your arms out like this. This is abduction and abduction. Moving them in. There you go. All right. Okay, so one more time, I'm gonna get you to roll your arms like this, so circumduction. And then if you could poke your head out like this, and then move in. This is protraction and retraction.
Okay.
Okay, and can you tilt your foot in like this, inverted,
Okay.
and exverted?
Okay.
Alright, now have a seat for me. Okay, so I'm gonna get you to push up on my hands and rotate back down. Very good. And I'm gonna go ahead and get you to flex your arms for me one more time and then extend them.
Okay.
Very good. So do you have a family history of any musculoskeletal problems, osteoporosis?
Just rheumatoid arthritis.
Okay, all right. So one more thing I'm going to get you to do is I'm going to get you to squeeze my fingers. Okay, very good. Okay, so I'm going to check the range of motion in your hips. If you could just go ahead and lie down for me. And I need you to pick one of the right leg up for me and back down. And go ahead with the left one. Okay, very good. Okay, Miss Jackie, so we're going to move along to the next part of the assessment. This will be the last part. I'm going to go ahead and do check for all 12 cranial nerves. We had earlier throughout the assessment, we had already started noticing. We've already gotten a few of them out of the way, so I'm going to go ahead and let you stand up for me. I'm going to perform a Romberg test.
Okay.
You will stand right there for me and put your arms out and heel to foot. If you could just walk in a straight line. Very good. Your gait is normal. And just turn around and go back for me, and gait is normal there. Okay. And I'm going to go ahead and just have a seat for me. And if you could close your eyes. And can you point where I'm touching you? Okay. And is that dull or sharp?
Sharp.
Sharp? Okay. What about this? Is that dull or sharp?
Dull.
Okay, and can you point to me? Point where? Okay. Good job. You can open your eyes. Go ahead and if you could just close your eyes for me. This is the olfactory cranial nerve number 1. This is the smell. If you could just tell me what you're smelling.
Alcohol.
Very good. Okay, so cranial nerve number 2 is optic, and we done that whenever we performed the smelling test with the smelling chart. Ocular motor is cranial nerve number 3, and that's follow my pen light for me. I'm gonna see if your eyes go downward and inward. Okay. Very good. Okay. Okay, so the trabecular is the cranial nerve number 4, and that's the eyes laterally looking downward. Okay, if you could move your eyes side to side for me, that's actually ocular motor, cranial nerve number 3. 5 would be trigeminal. Okay, so cranial nerve number 5 is trigeminal. I'm gonna get you to push on my hand for me. Okay. All right. Abductions is eyes side to side. Okay, very good. And number 9 is the facial. If you could smile for me and frown. Okay, stick your tongue out. Go Okay. The acoustic nerve is the whisper test we performed earlier. Glossio. Okay, so I already assessed your glossopharyngeal whenever I looked in the back of your throat, in your at your uvula. The vagus is the gag reflex, and so I'm going to go ahead and get you to stick your tongue out for me. Okay? Okay, good job. Okay, so spinal accessory is optic nerve number 11, and we already assessed that when I had you to move your head side to side.
Okay.
Hypoglossal is sticking the tongue out. If you could go ahead and do that for me and move side to side. Very good, and that concludes all 12 cranial nerves. Okay, so I'm going to go ahead and check for the reflexes in your knee. Deep tendon reflex, which is also known as DTR. And go ahead and, okay. All right, good job. And I'm going to, one other thing is the Graftesia test. If you could put your hand out for me and close your eyes. I'm going to draw something on your hand. You tell me what you can feel.
Oh.
Okay, and let me see this hand.
Okay.
Good job. Okay. All right. One last thing is the Brudinsky test, and that's just checking to see if you have meningitis. So if you, I'm gonna put my hand here and on the back of the neck. If you could look down for me and look up. And so no Brudinsky. That's good. Okay, so Ms. Chaplin, that concludes our head to toe assessment. Based on my findings, I'm going to go ahead and document everything. And if you need anything, just let me know. And I'm performing hand hygiene and exiting the room. Okay, Ms. Jackie, so that concludes the head to toe assessment.
Okay.
Based on my findings, I'm going to go ahead and document everything based on my findings today. Do you have any questions for me?
Nope.
All right, well, I'm performing hand hygiene. If you need me, just let me know, and I'm exiting the room.
Thank you.